Okay, here we go. So, um, for some of this is being caught on Facebook, and some
Hmm.
of this is being caught through the audio medium of RTV, and that's where we're at with RTV. And
Hmm.
one thing, Animology and Curtis, who's the lead here that helps me do these technical things. Interesting enough, when I first started doing this, it was like five people in the room, and someone was on the camera, and someone was on the
Hmm.
board. And now we've, because the level of technology, been able to move it to, a one
Hmm.
person
Good.
operation. So
Yeah.
thank you. So wanted to talk with you a little bit about um, why African American mental health is a different breed of cat,
Hmm.
particularly as it relates to uh, treatment and counseling. And today, in May, is Mental Health Awareness Month, so it seems kind of apropos we're having a
Hmm.
discussion here today. It's been one of our focuses here, and because if you don't treat the body, if you don't treat the mind, you can't treat the body. If you don't
Hmm.
treat the body, the mind may not follow. So um, it's what we find to be. Tell me a little bit about what you think are African Americans' fears about mental health and about coming in for treatment as well as even medications.
Yes. I think when we look at some of the history, um, and how, especially as African Americans, being easily pathologized, there are some assessments and things in mental health that, because of the experiences we have as African Americans, will rate our like there are certain depression scales and things where we'll rate higher because of our experiences, but it'll be looked at and pathologized as if we are severely depressed when it may be our own experiences, because these tests are normed on the dominant culture, white people, Caucasian population. So when you have a test that is, or assessment that's created off of that, and then us taking the test, we're going to rate differently, and then therefore be looked at differently. And that's one of the things. And we can think about even further back where slaves who escaped their masters that was considered a disorder, a mental disorder, that we're running from freedom from something that was unlawful to begin with. And so we can see how, even in special education, overrepresentation of African Americans. So all these things would make, I think, anyone hesitant to partake in certain spaces where they would be evaluated in that way. And so where do we go? We'll go to the church, we'll go to our family members, we'll go to friends for support, which can be helpful, but it doesn't always get to where we may need to get depending on the depth. And I will say, something we see in our community now, is an awareness of that, but also such a there are local psychologists here in the Bay Area working with barbershops, because and training barbers on first line mental health awareness and support, so that.
Beauticians too.
Huh?
Beauticians
Yeah,
too.
okay, right. So we see that, okay, if these are some of the places we go for our support, that we feel safe, then let's help these people to be able to have the recognition to see, okay, if maybe something else is going on here. Can we try to help them to find a provider, that can understand them? And then getting back to the culturally responsive piece, when we think about, and we can just talk locally in terms of the culturally responsive integrated healthcare centers that are for other minority groups. We have Native American Health Center. There are uh, other centers that serve a Latinx population, Asian American population. Um, I did
But
training.
no African
No,
American.
right. I did training Hawaii, Native Hawaiian system, but no African American systems. Um,
I think
there
that
are.
kind of. I
Yeah.
was just pull up some data. It's this is from the California Healthcare Almanac,
Hmm.
July 2013. It says that at that time, this is 2013, and this is post pandemic. So you have to go exponentially higher now. It said that nearly
Hmm.
1 in 6 Californian adults has a mental health need, and
Hmm.
approximately 1 in 20 suffers from a serious mental health illness that makes it difficult to carry out major life activities.
Hmm.
Preface that with COVID and people of color.
Right. And so I think when we think about us and the other underlying things, that we go through, the dismissal of the racial experience, discrimination, gaslighting, things that we go through daily. And so dealing with that and then exacerbate that with the isolation that happened due to the COVID pandemic, where not able to access some of the support systems that we have as people. And so it really highlights the need for the cultural care. And like Brother George mentioned, no African American integrated healthcare in the United States.
So one of the things that we think that, because this gets to a discussion of healthcare disparities and parity
Mm.
and disparity,
Mm-hmm.
and why our outcomes are so poor. One of the interesting things that in May is Mental Health Month, they're launching. You can go to the SAMA website for mental health,
awareness.
and it talks about the number of programs. And what I was impressed about is the number of programs that's being delegated to not only adolescent mental health care, but a cultural responsive health care, and as far as different communities, LBGT, and because what we saw in COVID is a really increase in domestic violence, a real increase in trauma, and now we're seeing it in our kids in terms of a really maybe behind school, maybe even 2 to 3 years in math and English skills. So it has had a mental health devastating impact on us. I'm glad you were able to bring that up. In the African American experience, because that's what we're talking about. And so when again, I speak about and take care of everyone, but I want to be clear about the fact that I think the African American experience is unique. You are unique as an African American clinician that wants to see African American people in a holistic and compassionate and a shared decision making manner. So I want to commend you for that. I would like to kind of have your thoughts on the pipeline of clinicians. 85% of the clinicians are white. 3 to 5% are black, and when you get to mental health, you maybe see 1 to 2%, which makes you really, 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 really weak. The structural and institutional racism that allows folks to be, I was thinking, I was watching this race, and I was watching this young African American out of Penn State was running 4x4 relay. And when I was at the Million Man March, they said that white males get Penn State, African Americans get the state pen.
Wow.
And I saw this brother run out thinking, oh my Lord, he doesn't even know. He probably does. But it's the discussion that our mental health concerns, as well as our health concerns, are unique for us, and in most times have been dismissed by the organized medicine.
Yeah.
And what I've said is that when people don't like you, then they don't want to take care of you.
Yeah. Yeah. And I think that's why what we're trying to do is so important. And this is only the tip of the iceberg, because having, one integrated health center for African Americans is not going to serve. We can't serve everybody. Like you said, our goal, we're not turning people away, but our focus is culturally responsive care for African Americans. And so considering the percentage, 1% or 2% of clinicians are black, and same in
African
provider space, African American or African American. So
and it's the diaspora, and it's almost like on the job applications. They tell you the race issue, they say black and then they say African American. Black is a diaspora. African American specifically speaks to a group of Africans who were born here in 1619.
Gotcha. Okay.
And so always I had to draw that distinction, because that's why everybody can't have reparations.
Got you. Yeah, you're right. And that's a good point. I think the way I grew up, I looked at it. You're correct.
Mm-hmm.
I didn't think of it that way. I'm thinking, if somebody asks me what my nationality is, I'm American. Why is there a hyphen? But I see your point. It has to designate and differentiate between, like you said, black could include groups from other, Africans, Jamaicans, people that
Oh
weren't there.
God,
Yeah,
it's a
right.
diaspora.
Right,
It's a
exactly.
diaspora.
Yeah, the whole, and
Yeah.
so it doesn't differentiate. So right, I see why you.
Yeah. So I mean,
Yeah.
and well, because again, if the healthcare concerns are unique, I'm sure a African coming from the continent could have those same issues, but not in the way that we experienced it
Right. I see
because
your
of
point.
our Middle Passage experience.
Mm-hmm.
And I'll give you an example. And this is all about mental health, believe it or not, folks. It's about how we view ourselves and how we think, and how two African American clinicians have to, at the end of the day, treat people the same, but understand there are always some unique things that are happening with the people that we serve. We call people of color, that we call African Americans.
Mm-hmm.
You know, um, so I think that, in fact, Mosey made the first contact with me in regards to becoming at that time just a soldier on the leadership team, and we were trying to transition to seeing the same thing, and saying that we have to have this healthcare center in place because it will uniquely serve a group of people that are not being served, and I think within that healing environment, we will be able to make some changes that are inspirational.
Absolutely.
And serve as a roadmap and a gold standard for the care of African Americans.
Absolutely.
And it's almost what I say about us, myself, you, Cheryl Crenshaw, Dr. Green, is that we do this work daily, but we love the work we do also.
Yeah.
Yeah.
Like Cheryl used to call it heart work.
Oh yeah.
Oh,
definitely.
And we think about the dimensions of what it will look like, particularly with mental health. There's so many things. I mean, we have counseling that is, one aspect of individual, group, family, but the other part of things, particularly from a social work perspective, is the interventions such as, town hall, advocacy, speaking, the fact, the opportunity to speak about an experience before stakeholders and others. That's a healing. That's an intervention too. Us having a sit-in or peaceful protest regarding issues. These things are therapeutic too. And so when we think about our people and the way that we have taken care of ourselves over the years, we want to implement these types of practices into mental health as well.
The healing circles are a real large problem.
Yes.
I mean, a real large aspect that Cheryl brought to the table and says as a part of our therapeutic program, which I really have to commend because it does have African has an African focus to it that sends a cultural piece about the circle and being unbroken and us sharing those experiences within that space. And so we think those things don't happen in generalized Western medicine. We don't think those things happen in your standard urgent cares.
Right.
And so I always say the treatment of people like McDonald's hamburgers on the assembly line. And that's what kind of corrupts our care.
Yeah.
And in reality, clinicians are being asked to do more with less. EHRs, electronic medical record systems, that are kind of antithetical to practice and the increased burden of documentation.
Yeah.
And so, within all that sphere that we have to function in, we want to provide a quality product to the people we take care of. Because at the end of the day, that's what this is about.
Right.
How do you think artificial intelligence is going to affect our care, our cultural care, and what do you think it's going to mean? I personally think. What do you think?
You know, and I was talking to my mom about this yesterday. And
Hi, mom. Hey, mom.
it's when I think about healthcare, I think that because what can potentially happen is screening could become done by artificial intelligence in the sense because there's so many patients that need to be seen in all systems.
Right.
And so I think that
25%.
there's a I think a temptation, if you will, for that, to, we can do the screening part and have AI screen people, but things are going to be missed. Okay. But I think that they're going to try as many steps as can be done with this. I think there is always that potential that can be used for that. I don't think it should be, but I think it is possible. So we really want to try to be careful. It's a tool that can be used. I mean, when you talked about the burden of paperwork, maybe we can use it to get this stuff done with the chat thing or whatever. You get that stuff done, but and get it out of the way so we can focus on the care, right? But I think as a society, we have to be careful in using it in the actual patient care. Yeah,
I think. Well, again, back to data. It said that the state of mental illness. This is around 2009. 7.6 children with serious emotional disturbance. I think that's higher. 4.3%, and we're talking about California. Adults with serious mental illness, I think that's higher. 15.9% adults with any mental illness, I think that's higher. And African American communities, I think we're underrepresented in terms of health care and mental health concerns. So whatever the data is, they're pushing, I'd say, times two for us.
I wouldn't disagree with you because why would we report it? Because you think if I say this, they might come for me, right? If I say I'm having these issues, I don't know what they're doing with this information. They might come for me. They might come for my kids. I remember I was working in an ER as a social worker, and I come in and say I'm a social worker. I'm just providing support. They might need lodging or something like that. But as soon as they think social worker, they think, it's a Pete's hospital. Something's wrong. They come to take the kids, that kind of thing. And so why would I share certain symptoms with certain people? I don't know what's going to be done with this information.
It says mental illness is defined, and I'm going to see if you agree with these definitions. An adult with any mental illness is a person 18 or older who currently has or at any time in the past has had a diagnosable mental, behavioral, emotional disorder regardless of the level of impairment carrying out major life activities. This category includes people with serious, moderate, or mild functional impairment. What do you think?
It's interesting because if they're saying diagnosable, but I feel like, that could be a reason why I wonder if people that are filling out surveys are thinking in that way. I wonder if they're just thinking, am I having issues with my mental health? You said it's underrepresented anyway, but I think that doesn't get to it. I mean, my own.
In other words, the underlabeling or the overlabeling of us as a mental health concern. And when the discussion around use of medicines and how medicines are appropriated, it gets one to thinking about why we tend to get less medicine or more medicine. Yes. So it's like pain. You need getting less pain medicine or more pain medicine.
Right. And as a prescriber yourself, the pressures we've talked about,
Oh God. And the question is, are Western systems efficient enough to take care of African American healthcare problems? And resoundingly, it seems like they aren't. And there's a balance. I've worked in, there has to be a balance. Yes, some people need medicine, but not all people need medicine, and not all people need as much medicine. And I think about the in-home population, development disabled, and some of the discussions around the use of pharmacological restraints, and particularly, and you dig into African Americans, probably more used on than there should be.
Yep, just dope them up.
Exactly. And there's been an issue with it, and I think the only issue, because it's such a large industry, if there were more overdoses, it'd be more of an issue, but it hasn't been. But you're getting more folks that are addicted as they get to their adulthood, and so it's really changed. Well, you can tell me this, the use of benzodiazepines. Are you seeing less of a use of those now? I know in the acute setting, yes, but it gets to our perception of medicines and what they do and what they should do. And like, shoot, benzos were candy for a long time.
Well, like I think I'm seeing less from my view because of laws that have changed that have kind of restricted providers' ability to prescribe those, and so now I see patients who understand that that's what's happening, but they're still addicted.
Oh yeah,
and they're just not getting it. You hear stories. Okay, well, if you're not going to give it to me, I'm going to the street.
Yeah,
to get it.
Exactly. And folks, just with benzodiazepines or anti-anxiety medicines. It's Valium, it's Xanax, it's it's those are the major ones. Clozapam, major ones. And so for a long time, these medicines like opiates were kind of like candy. You gave them out.
Wow.
And now you can't.
Right.
And I think that's a good thing. Right. But by the same token, is that what I say about me prescribing these things until you make the law so that I don't go into any kind of legal harm because a person overdoses or using it inaccurately, I seldom prescribe them,
right.
Or I'm getting people off of them.
And when the laws change, you have these people. How is there the time to really step them down or titrate down, whatever?
But folks don't understand. I think that it was some major suits brought against the pharmaceutical companies in regards to the opiate drugs, hydrocodone, and with the overdose issue, and they also sued the CVS and those kinds of marketplaces that were dispensing them. So they got the folks that were selling and the folks that were distributing, because they were saying that they should realize that these numbers were too huge, and so but the providers weren't hit because there was always things changing in my mind to have you stop prescribing anyway if you want to continue to practice.
Right.
So it happened really quickly too, because all of a sudden some of the folks that were really overprescribing were being brought to in front of the legal system, and it just that was that. Anyway, well, my point is that why we need these kind of healthcare centers is that maybe they'll limit the amount of substances we have to give people, and create a culture of as limited drugs as possible. If needed, yes, you're going to need blood pressure medicine, you're going to need diabetes medicine, you're going to need some psychiatric medicine.
Yes.
But within intelligent amounts, and trying to make sure all the other things, all the social determinants, as you say, speak about social determinants in mental health.
I mean, you have access, and we have things, there are other things that we can try to ameliorate, fix first. We can look at food shortage, other behaviors, whether it's smoking cessation, alcohol, lodging, being able to get to the clinic. Let's look at these things first. See, how can we help with those first? If medication isn't the front line, if we can say, okay, what else can we do? Like when you mentioned the way that you practice, kind of. So if we're thinking of other things first, and like you said, obviously medications are needed at some point, but what are the other things we can work on, first? Health, exercise,
and really be committed to that. But also, the reimbursement models have to be so that those ways of treating things differently are honored versus penalized
and rewarded. Yeah, because you think, well, if we're not going to get money for doing these things, then why? I might as well do the meds so I can get. Yeah.
The major closing of rural hospitals has to do with the bottom line. And so the bottom line is closing a lot of rural hospitals, a lot of rural health clinics. and then we see the layer of oppression with the laws being designed in regards to penalization of physicians for practicing abortion, providing abortion services. And what people have to realize is if it's abortion services today, it's addiction services tomorrow, and then it's whatever next. You know, we're going to outlaw this in our society, in our country, so you can't get, or you can't be treated because you're LBGT. So that's, again, it's a way of, now that's cancel culture.
Okay, yeah.
That's cancel culture. What are you finding rewarding about your work? First of all, I want to thank you for.
Well, thank you, bro, for
doing what you do.
Answering the phone. With that first conversation, we talked for an hour and a half. Never met, nothing. Just
Because things that make sense, we should want to listen to, and at least give it the light of day.
Right.
Because you never know where God's going to be moving you.
Yeah, and
you never know where Allah's going to be moving you. So I want to give a special shout out to my son Kenyatta Pearson. He was born April 22nd, 1973. He furnished me a real great granddaughter who I now have 4 great granddaughters. Okay. He's trying to populate the world, but that's okay. I'm cool with that.
Be fruitful and multiply. Okay.
Exactly.
Yeah.
But I need to shout that out because this medium allows us to extend, and I always want to give the people that have made me who I am, and the reason why I'm here in this chair is because of him.
All right.
And in terms of my mental health, and want to always acknowledge that we always are on the shoulders and backs of somebody, and I was on the shoulders and backs of my son as I was trying to move forward with him.
All right. Okay.
Anyway, say that.
You asked what I find rewarding, and I think it's bringing awareness. That's one thing is what I tell people what we're working on, and it could be African Americans or just people I know that aren't Black or African American whites. I never realized. You know what? I don't know why that's a thing. There isn't an African American integrated health center, and they just never thought about it. And so that for me, and people are, and then they'll say, keep me up on what's going on with you guys, and kind of wanting to reach out and support. And so I that for me is empowering, and it's rewarding, like taking each step as we work together and get closer to launching and putting things together. That is rewarding. Doing something that I know can help our community. That's one thing Cheryl said, that is just the fact of people knowing that we're here.
Right.
They may not even come. They may have services elsewhere, but the fact that they're knowing that something has been done that validates them to say, look, we see you and we know the need is there, and so here we are providing this space. We're here.
I think that I like this line, unapologetically Black, unapologetically African American. And so I think that for a long time, talking about our needs was almost a discussion around us whining, us playing victim, and we should be more grateful for all the things that we have received in this country. Wow. And I think that that's to our detriment.
Yes.
Because the things that, some of the data says that adult California women were more likely than men to experience serious mental illness. Rates of serious mental illness increased steadily by age group: 2% 18 to 20, a peak of 6.2% 35 to 44, and rates fell to a low 1.6 among those age 65 or over. Again, I think we're undervalued, undertreated. What about African American women and mental health? I think that I've launched a number of discussions
Mm,
and topics in the show about, I want the women that are of African American descent to be strong, but they don't have to be super.
right, right.
And one of the discussions around our mental health is taking the albatross that has been placed on the women,
Hmm.
African American women, and I'm thinking about my mother, my
Yeah,
sister,
yeah.
uh, my family, my patients, my
Hmm.
loved ones, all those that have come before me, all those who will go after me.
Hmm.
Conceivably, that's something I think that that needs to be addressed because um, when you're hurting and you're crying and no one's hearing, that's the worst thing that can be.
Mm,
You know.
yeah,
Um,
definitely. The undervalued, underappreciation in society of black women. Also, I mean, a double minority, black and African American, and a woman. And so, what in the workspace? Well, she's carrying a family in a lot of situations, and in the workplace, well, how strong can she be? Right? She can't have too much of a voice. She's not allowed to.
yeah.
But then, how can she wear hair and in outfits and all these, all the things that she has to deal with?
Mhm.
I think of my mom too. A very strong African American woman, and you just, it kind of brings to bear. You think about all the things that they deal with, and having to carry the family. When is there time for them to get their own mental health treatment?
Right. Exactly.
Right?
Exactly.
And we think about being 3 times more likely to lose children in childbirth in this country, and the mental health challenges coming along with, well, postpartum depression and things, along with that, the loss of a child, if that's the case, and just so many things that are overlooked.
Yeah. It says
Yeah.
the rates of serious mental, and again, this is from a work 2013,
Uh-huh.
and so I just
You just taking up,
just
yeah,
double
yeah,
up that,
uh-huh,
just
yeah,
double everything up.
yeah.
The rates of serious illness was highest among the poorest Californians. Here's something you would bring it up too. It says depression is one of the most prevalent mental health disorders among adolescents between 2005 and 2000. Approximately 8% of teens in California in the U.S. report they had experienced an episode of major depression the
Mm,
previous year. And then we're just going to roll that into COVID, roll that into, 300 years of institutional structural racism.
mm,
I tell folks that, our discussion is that the first 10 presidents in America were slave owners. And
mm,
just think about that. Just
right.
think about a Jefferson, you know,
Mm-hmm.
think about a Washington when there are no white Washingtons.
Right. I remember you mentioned that.
You
Yeah.
know,
Hmm. So
the
yes.
discussion around no white Washington. So we're clear, folks. Washington's wife had 4 children. This is the first president of the United States. He never consummated a relationship with Martha to have children. He never had children by her.
Mm.
But we have a majority of black Washingtons. So guess what happened? That's why they call him the father of our country.
Mm. Wow.
Anyway,
Yeah.
another discussion. Another discussion. I had to look that up. I was like, wow,
I remember you mentioned that, and we said, wait a minute.
GBT chat. It- I guess too is that the discussion around mood orders in African
Hmm.
American
Yeah.
folk, particularly um, anxiety and depression. Talk to me a little bit about how it's presented and what do you think about treatments like cognitive behavioral therapy? I know we have the SSRIs and all the rest of it, but
Right. Right.
how is you get someone to engage as an African American person about the issue around depression and anxiety as just a discussion?
For me, it's starting with just validating the experience,
Mhm.
because a lot of time there are clinicians that don't do that, and so we, in thinking about how that can contribute to, let's say, the hopelessness, which can be one, the criteria of depression. If I'm not being heard about what's happening in my life, um, then there's no hope. I mean, how am I going to get out of this? I'm
If you
being
can't
treated
take
this way.
care, if you can't take care of yourself, you can't take care of anyone else.
Exactly. And how do you change what you can't acknowledge if the therapist can't acknowledge it? And so when we think about traditional approaches such as cognitive behavioral therapy, well, sometimes changing the thought to something alternative thought is not going to necessarily work. With if I'm continually going through this, racialized experiences every single day, and I'm just supposed to change the thought to, oh, well, it's not. Sometimes it's, we know this is the world we live in, and then there are other approaches that we think about, whether it's ACT, acceptance commitment therapy, and these are all Western approaches, but I try to take from different ones and see things that work for people. So we're in this situation. We're going to try to change it, but right now we're in it. So what can I do to support you through it? And how can we manage the symptoms of, manage the anger, find outlets for that, manage the rage that we have, the frustration, all these things. How can we, dealing with these emotions that we currently have, and how can I learn to tolerate the distress while I'm trying to make a change? Because we can't just change these situations. We see it's taken hundreds of years to make small changes in the law. So we can't just change the law, change your life. It's not going to necessarily work like that for us. And when we think about, Western medicine and the history of us being maligned through research, medical research, and uh, faulty research saying that we don't, we can take more pain than other people that are non-African American, those kind of things. I remember my buddy told me when the COVID vaccines came out, he said, "Why do they care about us now? Wondering whether I should even believe. Why should I get this vaccine? Why do they, dominant culture? Why do they care about us now?" I didn't know what to say to that. What I said was, well, they don't. But if everybody doesn't do this vaccine, we're not going to get herd immunity. So it's not even caring. So people think, why should I care? Why should I do this when my people have been maligned by the history research and everything for years anyway? Now all of a sudden they're going to treat us better. You say, well, why should I even do this? Why does it matter?
I always say to folks that you grew up in the era of vaccines. I'm 67. And I grew up in the era of vaccines. That's how you got here to have this discussion. So, but look, we have too many skeletons in our closet, with the Tuskegee studies,
right,
or the young women who sell, they use Roberta Links. I'm drawing a blank on her, but they used her cells. For a number of years, and the bio companies in California reap the benefits off of that woman's body. So we have a long history, maternal, death, and just why we have never gotten better in this system, because it was designed for us to get better. Just like education was designed for us, because there were points in time in society when it was illegal for us to be taught to read and write. And so that doesn't just go away after 300 years. That stays with you. That's the internal structural imprints that we have. Interesting thing says suicide rates in California differ dramatically by gender and race. The suicide for men was 3 times as high as the rate for women. Among all other race, and I'll get to this, among all the race ethnic groups, whites had the highest suicide rate. White men, older white men, this is how we looked at the data, had the highest suicide rate. But what I think is missed is how young African American men are being killed in a thing I think it's called fratricide, where basically they're putting themselves in harm's way. Because anytime you want to carry a gun, sideshow, race, is that a call to suicide? It has to be. And it's getting so unreal now that we're going back to, used to be just guns. Now it's guns and knives. So if I can't get a gun, I'm going to get a knife. Okay?
What was the term you used?
Fascicide. It's a discussion around almost killing yourself.
Risky behavior that takes your life. Okay.
So these kinds of things are developed when a young African American, Hispanic, of quote unquote Asian.
Hmm.
I think in young Africans coming from another country that have been transplanted here through family and are going through the system, they feel, you know, they don't feel as though they have a place. The other thing that I noticed is that it was mentioned last night. I was doing some research stuff that men, young men, I'll say between 15 and 35, do not want to work.
Hmm.
And they do not want to work because they feel that the work they are doing does not provide them with, they're not telling someone what to do. They're not management. They're a
Oh, okay.
worker.
Right.
Now, I got you. The women in that same age group are working. They're working and they're going to school. And by the time this ends out, you're going to have more educated women of color with this group of men that have any work history. What is that going to mean for the society in terms of, and this is cross racial issues. White males, in fact, white males are kind of less educated and less prone, more prone to this whole uh, September 11th,
Just
January
January
6th,
6th
January 6th issue.
entitlement kind of. Yeah.
Yeah, that's where their mindsets are going.
Hmm.
That's what you're seeing. That's why this whole pickup with guns. Guns is power, right? It's just not protecting yourself. It's not just protecting yourself. It's your ability to inflict harm if you have to.
Hmm.
That's how a
And
guy
to get
gets
instant
strangled.
respect and
That's how a guy gets strangled in the subway in New York.
yeah, I heard about that one. It's just
You know, consistent
ability to.
trauma, immediate trauma, but the men that are that men tend to have a more lethal way of providing suicide. Where
Hmm.
the guy that gets up here, death by police, death by
Yeah, death
police.
by cop, police,
Yeah, yeah,
suicide by cop. Yeah.
yeah, yeah. And so that's our kind of. I mean, you do the mental health. I mean, I do it,
Yeah.
but the mental health pictures tend to be moving to that, and those groups have not been treated because it starts in adolescence and they never get any treatment. So by the time they're 18, 19, they're picking up an AR-15.
Right. And I think that, and we've seen that, with a lot of the shootings and things happening in our society, and one of the responses, instead of um, reducing access to guns, particularly, I guess, semi-automatic weapons, is mental health support. But and I agree that it can help, but it's all voluntary. And so you can't make someone go to treatment unless they've already been uh, arrested, and that's whether or not they're really participating or if they're in a facility. But that's already engaged with the psychiatric services. That's not somebody.
Speaking of that,
Yeah.
what do you think about the new law that's going to have mental health courts throughout the state and remand people to treatment if they are deemed needing treatment? Um, it just leaped the last, I think, hurdle, and they're starting to develop the courts now. It's going to be about 12 of them throughout the state. They were doing it in New York also.
Okay.
And so, but there's no plan.
Yeah.
You can take somebody in time before they need mental health treatment, but again, those folks are usually, again, had this discussion with folks in the program, is that a majority of the homeless have mental health concerns. And so this is me.
Yeah.
I believe the governor of the state, Gavin Newsom, wants to be president. That's why he didn't declare. He has to clean up this homeless issue and this mental health issue. And so he's put everything in place. That's where, again, he's having Medicare converted to CalAIM. And so it's going to include the mental health. This is, again, back to our format of why we need to be moving to this model, because the major players are moving to that model of integrated services.
Okay.
Yeah,
I would wonder, what kind of services are mandated? Is this just because it's the ongoing treatment that's going to be what really causes change? But again, it's voluntary. So, like, say if somebody has committed, they committed a crime that they would have mandated this to have or remanded, returned to have mental health services? Is that what it was? Is the crimes they commit that causes that,
No, it
or
will be that they are considered needing treatment, that they
okay,
are a danger to themselves, a danger to others, and part of their recovery of getting off the street will to seek get mental health. Uh,
okay,
Again, this is a way of managing folks, whether you like it or not. What has not worked, or what we're doing now.
right,
So uh, I only bring it up because I think it's going to impact young men of color more so than any other group.
yeah, mm-hmm.
As a group they're going to
Because that's going
target.
to be who's being seen,
And
who's being
so
sent, yeah,
that's why I've been talking about this for the last 2 years. It's already law. It's already uh, being as soon as they develop the court structure, it's going to be on. And it's probably looking at the midsummer, late summer. That's when they're not talking about it because it's already in place and being developed now. So, but families wanted it, communities wanted it, we can no longer have the prison as our repository for mental health issues. Particularly young men. That's where this whole suit against Alameda County came about because young African Americans were being incarcerated, but there were no services for them.
right.
And so it became a revolving door, from couch to hospital to street to jail. That was the cycle. And so um, there's not been enough support services. In fact, they're saying said national estimated expenditures for mental health have not increased as fast as those for the general health care, except for 1998 to 2002. So that's why we need to have an integrated healthcare model so that we get the service that we need in one locale,
Right,
as opposed to it being dispersed. Because when it's dispersed, you know this. Tell me how a person gets to your clinic, and I'll tell you if they're going to get to the clinic or not.
There you go.
Yeah.
I think that is part of it's going to come down to, and I've worked in comprehensive care settings, and a lot of times it's okay. Social work's coming in or therapists coming. You want to see them? Nope, I'm good. And then doctor provider comes. Oh, doctor, this because and people don't realize they about 3 out of 4 medical concerns are psychosocial, have a psychosocial component to it.
Right.
So when people sometimes we tend to think it's just body, but like you said, it's all connected, right?
Right.
And so there is so much of the rejection of mental health services sometimes in these settings. And part of it's the stigma that comes with it. I can see, I went to the doctor for a checkup.
He said I was crazy.
Right.
And he was right.
Or I went to the doctor, so nobody gonna say anything. I had a mental health checkup. All of a sudden, people look. Wait a minute. What happened?
Talk to you.
I say health, mental health. Oh, wait a minute. Now it's got the stigma. So now people, I'm good, even though we, especially as black men, right? We're dying inside, but you're not going to say no. I can't admit that, right? And so that is another part of it in terms of seeking out services, or when these services are really, really curious to see what it'll look like when it's in the prisons, and when it's presented, is it the person's choice? I don't want that, or whatever, because it can be available. We can see clearly they weren't being served. But I just wonder what it's going to look like.
I ask people to look at the foundations of trauma and abuse, and just respect and displacement of care, and minimization of care. And what I tell people is public health is not public. COVID showed us that the public health system has a lot of holes in it. And the great resignation, in my mind, was about folks not wanting to serve the communities they were going to serve. So for me, it was HIV in 1984. We didn't know what it was.
Mm-hmm.
We didn't know how it was transmitted. We knew a lot of white men were dying. So what's wrong with that? And then
Mm-hmm.
you realize it starts to matriculate into the community,
Mm-hmm.
and then your churches and movie stars and rappers are getting sick, and so it
Mm-hmm.
becomes a whole issue about its treatment. So the parallel is that I found that when it's just affecting one particular community, it's not as important as it's affecting
Right.
the global community.
Yes. Then nobody cares until wait, now I can get over to me. Okay, hold up.
Yeah,
Now we got to just yeah.
mental health,
Right.
gun
Right.
violence, homelessness now are issues that affect the entire. It affects the entire state of the economy until California, particularly.
Mm-hmm. Mm-hmm.
So now it's an issue.
Now it's
Now,
an issue.
but I think that mental health is so essential to our physical health,
Yes. Mm-hmm.
and we need to um, develop models that speak more to our needs, wants, and issues. We've got about we got about 3 or 4 minutes. I want
Okay,
to let
sir.
you close out and give us some your high points in terms of the future mental health for African Americans / Africans in
Mm-hmm.
Bay Area.
Well, thank you, brother George, and
Thank you for coming on.
yeah, thank you for having me. And by the grace of God, I'm here. I have a blood disorder, hemophilia, which
I was going to bring that
yeah,
up.
yeah,
I
yeah.
was going to bring that
No,
up. Sorry.
no.
Okay.
I
Okay.
appreciate you. Yeah,
Okay.
and I work in that community in the health in mental health setting, clinical social worker, and it was an AIDS epidemic within that community, and so you saw, some of the, it wasn't that people weren't concerned with our community until then all of a sudden with more and more people, now it's an issue. Now we need to do something about it. So I've seen it in that setting, and I see it with our African American people as well, and so what we want to do with Conscious Voices in terms of an African American integrated health center is provide this space where and you mentioned shared decision making, where we, as George, as a medical provider and mental health provider, we come alongside the patient as a team, as a family, and say, look, what are you going through? We're sitting down with them together. A lot of the comprehensive models, okay, you see the doctor, boom, see the nurse, boom, but we want to come down and be there with the patient together, and let's talk about what you're going through and how each of us can help you through that. And so it's a different model. Takes more time in a sense, in some ways, but in some ways not so much because we're all with you together. And I'm really encouraged about that kind of a family village model to try to help and really look at, all the things that are impacting you and how we all can help. And some of the response we've got just from the idea of what we're trying to do, and we already do mental health work in the community, and I've done some work with schools as well, and so just looking forward to continuing that work,
Yeah.
and just continuing to build and step by step, and also making the community aware. Like I said, a lot of Black people didn't even think about. Like we've talked to other providers in the community, other people working in public health. Oh, there are health centers here that serve Black people. True, there are Black doctors, plenty, Black providers, but there isn't an integrated health center where they can receive the culturally responsive care. That doesn't exist. There's one in Canada for Black people there, but in the United States, and we've had, Black Wall Street. There were hospitals there in the community. Black Panthers had a clinic in the center, right?
West Oakland Health Center.
Right.
Was considered to be
Considered African American health. So we see there have been service for our community. So we just want to build on that tradition and continue where we are now. Responding for our people, particularly after the pandemic and everything happening now. It's a time where, like you said, mental health as needs have increased in the community I work with in hemophilia. 50% reported, and then remember we talked about people underreported. 50% reported, but only 25% reported getting services. So if we take those numbers out, then you realize there's even more people that need it, and even less are getting.
So is that mental health illnesses are the most common illness in terms of concerns. And we tend to under-evaluate and under-treat those concerns.
Yeah.
I think that we're going to move far away to bridging those gaps. And we're really interested in, the community coming out, returning from jail, and we're really interested in women and infant mortality and prenatal care. We're really interested in trauma medicine and behavioral health services. We want this to be a very comprehensive situation.
Yeah.
And the providers have to be multi-tooled. And because as we do our patient-centered orientations, we'll need to be addressing all those things in one particular visit, because that saves the patient time. Ooh, wow, saving the patient time, which is great. So that they get everything they need in one particular aspect, as opposed to having to continue to travel over everywhere to get the services that they need. Yeah. And that's what kind of is frustrating for me, and I think it's frustrating for patients when they have to farm themselves out to do that.
Right, going to one clinic over here and one over here.
Exactly. It's not only is it tiring, it's frustrating, because that means that you have to orientate your day around where the facility is, as opposed to being able to have the service at the facility and go on about your day
and go back to work and go take a whole day off of work.
Whatever it is that you wanted to do.
Right.
I think that that's what has to happen. Most, as I said, I'm going to give you the final word.
Okay. Well, thank you, brother. We appreciate everyone who's here and listening in and supporting us, and we just want to continue to do this work.
You'll be hearing more he's going to be coming back.
I don't have the principles on my phone. I wanted to read the principles of healing the African American community. That might be a way to close. Is it going to cause a vibration difference? Okay.
It'll be fine. No, okay. Let's see if I can pull it up. And so this is something we open all of our conscious voices meetings with, we were talking about, we don't want to lose our health focus, and if they can bail out banks, malfeasance,
come on now,
poor management, then surely they can find some money for an African American healthcare center that particularly is focused on African Americans. Again, those are the 1619 Project. Hey, folks, check out my website. Find it.
Yeah.
And these are the principles of Conscious Voices.
These are 7 principles of healing the African American community. Number 1, unity, peace and trust among ourselves with an awareness of our connection to each other. 2, empowerment, taking personal responsibility for our future. 3, healthy families, taking good care of each other and protecting our children. They are our future. 4, economic development, working together for economic opportunity and success. 5, purpose, creating new opportunities and removing obstacles to success. 6, creativity, pooling our resources, skills, and talents for the enrichment of all. And 7, faith, a belief that despite the challenges, we will succeed. And if I give a shout out to our men's group, we have a men's healing circle that meets on Mondays on Zoom, African American Men's Healing Circle, and we'll give them a shout out. We've been slugging it out together throughout the pandemic, and so I just wanted to shout those brothers out.
And close it out. Mental health illnesses are common in the United States. It is estimated that more than 1 in 5 U.S. adults live with mental health illness. That's 57.8 million in 2021. Mental health illnesses include many different conditions of varying degrees of severity, ranging from mild, moderate to severe. 2 broad categories can be used to these conditions: any mental health illness and serious mental health illness. Encompasses all recognized mental health illnesses. We want to ensure that people are clear about the definitions and about how we're being treated, and because we understand that labeling is an issue for us.
Right.
And But the numbers are staggering. Young adults has the highest prevalence, 33.7%, and it was highest among mixed race. Again, it is a amazing month to look at mental health concerns and issues in our community, particularly as it relates to communities of color, particularly as it relates to African Americans. Mosey does a lot of cutting edge work, and he's taught me a lot about mental health in Africans in America. Mosey, I want to thank you for coming on.
I appreciate you.
Thank you for bringing light to a very dark world, and the vision is always seeing things and seeing true to you. Share, Dr. Green, and all the folks that are Conscious Voices, a leadership team, our visionaries. I want to thank you for all that you do, sir.
Thank you.
Folks, good night. We'll see you next week. Miss Howard, be back next week. Thank you again. Have a great week.